If you're digging a lacrosse ball into your glute to fix Piriformis Syndrome, stop immediately. There is a 94% chance you are treating the wrong body part and actively making your injury worse. Anatomy dictates reality. The sciatic nerve runs under the piriformis muscle, but in only 6% of sciatica cases is the muscle actually entrapping the nerve. For the vast majority of runners, that pain in your butt is a liar. It's not a local muscle problem, it's a referral pattern. Here is the twist that catches almost everyone. Your glute feels tight because your brain is trying to protect an irritated nerve, not because the muscle is short. When you aggressively stretch a protective muscle, you are fighting your body's defense mechanism. Worse, typical glute stretches wrap the sciatic nerve around the ischial tuberosity like a pulley system. This creates compressive load. If your nerve is already sensitized, stretching it is like rubbing sandpaper on a sunburn. So, if it's not the piriformis, what is it? Usually, it's a lumbar disc herniation at L5, S1, or proximal hamstring tendinopathy masquerading as hip pain. You need to differentiate the spine from the hip before you start rehab. Use this logic flow to screen yourself. If the slump test replicates your pain, the issue is likely spinal. If pain is localized strictly to the tendon attachment, look at the hamstring. Only suspect the piriformis if spinal tests are clear. To fix this, abandon the stretch. We need to calm the nerve and load the tissue. Start with nerve flossing to reduce sensitivity, then move immediately to isometric glute bridges. Build capacity, don't stretch into instability. Treat the origin, not the victim. Run smart.